In this video, I'll be talking about how a decentered and an irregular sized capsulorhexis is considered a risk factor for anterior capsule tears. So here's what we're used to as a well-centered capsulorhexis, and this is basically what your brain is used to in terms of your surgical zone where you can place your chopper and where you can place your phaco tip. But if you have a decentered capsulorhexis, as in this case to the right, and you're a right-handed surgeon, there's a high chance that your chopper may inadvertently cause an anterior capsular tear in this region here, because you're used to operating in this region with your chopper. And if you don't make a mental note of the fact that your capsulorhexis has shifted a little bit to the right, then your chopper may inadvertently hit this region. And the reverse is true for left-handed surgeons. So again, this is a decentered capsulorhexis to the left, and here is where the chopper is being utilized, and here usually is where you would have your chopper if the capsulorhexis was well centered. If you're not aware that the capsulorhexis is slightly decentered, as you enter the eye with the chopper, or as you exit the eye with the chopper, you may inadvertently cause an anterior capsular tear. And below is what is an irregular capsulorhexis, so it's well centered, but it's irregular. And so again, for a right-handed surgeon, you're typically going to bring your chopper in and out of the eye in this region here, and this is where you may inadvertently nick the anterior capsule, or even during chopping maneuvers, your brain is so used to that well-centered capsulorhexis that your brain thinks that this is a free zone for movement of surgical instruments, and so this is a area where you may get an anterior capsule tear. And again, vice versa for left-handed surgeons here. If you've got an irregular size capsulorhexis, there's a higher chance of the chopper engaging this area because there's more anterior capsular material here relative to other areas. And finally, the highest risk for anterior capsular tears is a decentered capsulorhexis that is also irregular in shape. In other words, a combination of these two. I hope you found this illustration to be useful to you, and thanks for watching.